when UnitedHealthcare announced that it was going to lose 600,000 members in the next AEP, a lot of people panicked and said, "What is going on? What is going on?" And they're just doing what Aetna did last year, that also shed 600,000 members. And Humana, to some extent, also did last year when they changed the plan for 500,000 members. They didn't necessarily exit with 500,000 members because they had a lot of plans that the members moved over to. But they both the carriers last year did it. And whenever a major Medicare Advantage move is made, everybody typically follows suit. So UnitedHealthcare is doing it this year, and they're kind of right-siding their business. So if you look at their Q2 growth, and I put it on the screen for the last 7 years, they're down. Their margin, their profit is down. And how is that when membership is up? When revenue is up? So you can have a lot of members and not make any money if you have members in the wrong plan. And this is, like I said, this is still a problem for the whole industry, not just for UnitedHealthcare, but for all the players, that they have to make sure that they right-side their membership. Remember when you first started with Medicare Advantage, the old timers, this is our 20th AEP, those of us that have been doing this for 20 years, remember back in the day when a carrier would come into a state and cherry pick the counties. They would put this county and these 4 counties and a cluster of 4 down there, and I don't want anything to do with these counties in the Northeast, because they looked at the CMS data for claims and they said, no, those aren't profitable counties. Those hospitals aren't profitable. There's not enough competition in this rural area. There's only one hospital. So they filed their plans in counties where they knew they could make a profit. And then now here we are 20 years later when it's pretty much coast to coast. There's still a couple holes in rural areas, but in general, every carrier is in almost every state and in almost every county in almost every state. Expansion has been consistent for the last 10 years. And now here we finally hit where they say, whoa, 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 the medical costs are really skyrocketing. They keep saying of pent up demand from COVID. And then we got the tariffs on medical supplies. Most of our drugs aren't made here. So drug tariffs, those things which we know will raise the prices again, are all coming in at the same time. So even though they have more members and their revenue is up, their costs are up even more than that, which is impacting profits. Again, not just on UnitedHealthcare, on all the carriers in the Medicare Advantage market. So they're all trying to be more strategic like they used to be back in the day, where they really look at the plans that they filed and they really look at their contracts with their providers, with their hospitals, and they say, nah, that county is not going to be profitable. Exit. That profit in that county is okay if we tweak the benefits a little bit. And these counties, this whole cluster of counties, were good. They're profitable. They're fine. They're gonna be the same for 2026. So the headlines are always screaming, things are falling. That's how people click on things. That's clickbait. But the reality is, this is not a singular problem for UnitedHealthcare or anybody else. This is an industry problem, and everybody has to right-side their benefits. Right-siding their benefits, for not all plans, but for a certain percentage of plans, means the benefits are going to be slimmer. I mean, I remember when there was a plan that had unlimited dental just about 3 years ago, and we're all going, whoa. I remember when plans just 3 years ago had $3,000 max dental, which was really attractive. Last year, we saw a lot of pullback on the dental. It got slimmer, or some plans ditched it altogether. That's a very popular benefit. But I think we'll see more plans this year that really slim down their dental or eliminate their dental. Now, here it is. We should know benefits by this time of year. Normally, we at the FMO level know, and we've gotten a lot of information that we could share behind the scenes with agents before it's public October 1st. But we still don't know it. We don't know it, and we probably won't know it until October 1st, like we did last year, which is unfortunate because it doesn't give you guys a lot of time to figure out what's going on in your market. And if you are in several states, that's really daunting to stay up late and try to figure this out. A lot of you are using AI to bridge that gap. Bless AI for this. but it puts us in a bad position when we have a lot of clients that will need to move. Now, my phone is ringing off the hook. People saying, what counties are exiting? They haven't told us yet. They told us there's going to be a lot of exits, but they haven't told us with specificity. Now we have a list of, from all the carriers, plans that have been suppressed. Now, why do they suppress commissions? Because they're not making money. They don't want more enrollment in that plan. So that's your first indicator that plan's probably going to exit. Doesn't always work out that way. Sometimes it's suppressed because actuarially they only wanted so much business and they got it and they don't want any more business. But more often than not, that was not a good plan for their county and they're going to pull back. So if you see suppressed, you can probably think, yeah, that's probably going to go away. Now, one carrier, and I'd love to shout out to them because I thought that was beautiful, they committed to us at the FMO annual meeting and they said, we will not suppress plans after AEP begins. If we were like, thank you, thank you, thank you, and I wish I could shout out to them. Because last year, we're like, okay, we know what's going on October 1st, and then by Halloween, one of the major carriers said, we're suppressing all of these plans. What? What? You were only actuarially fit to get 1 month worth of business? Like they don't tell you what their justification is. But that really hurt. And then it didn't stop. During the AEP last year, things kept happening. Now this company suppressed this amount of plans and this company did that. So the large national carrier, you know who you are, thank you, that said we will make our decision prior to AEP and you can take that to the bank. That will stay the same during AEP. That is our dream as insurance agents. And I wish everybody else out there that's listening says, oh, that's a good idea. We should do that too. We should have the foresight to do that before AEP for our agents, the field agents. Those of you that are watching this channel, we're field agents. We're the old timers, the face-to-facers. We know our clients personally. We still drive about 60% of the business to the insurance carriers. They still need us. As much as we think they're getting it all from the internal sales team or they're getting it from the large national call centers, no, they're still getting a huge percentage from us old guys that do business the old-fashioned belly-to-belly way. And we could really use that advance notice of what is going to be going on during the AEP. So you don't know. What happened last year where carriers stop and start, that is likely to continue this year. So as far as my initial comment, what's going on with UnitedHealthcare? They are doing what Aetna and Humana did last year. Any other carrier that hasn't done a large exit, are they likely to do it? Yeah, they're probably likely to do it. Maybe not on the scale of UnitedHealthcare. UnitedHealthcare is by far the largest Medicare Advantage company in the market. So it's going to hurt a little bit more. And anytime there's in the news, stirring up the news, people always say, is it a good company? And you don't want to go into too much how the sausage is made, but the fact that UnitedHealthcare is exiting doesn't reflect at all on it being a bad company or a good company. This is health insurance. This is happening to all the insurance companies. Now you might say, well, a little company, a little guy, they didn't do it. Well, they don't even have enough members yet. They have 100,000 members, or they might have 200,000 members. And you can probably think of some of the little startup guys that are in the market that we're thinking of, no, they're not exiting. They're still trying to grow enough to figure out what they even have. But the big guys, the big established household names, they're all following the same playbook because they're all under the same economic pressures. I hope this helped you. I know some of it was a little bit cryptic, so I can't name names, but I think you follow me. If you don't subscribe to our channel, Rebecca and I would appreciate it. Follow us. We'll keep you up to date on what's going on in the insurance market.